So anybody that has already slowed down digestion, so gastroparesis is the medical term, but any person that has trouble digesting food, it's going to make it worse. So we wouldn't want to use it in those patient populations. There is also a warning of pancreatitis. So with all of these medications, there is a warning that it can cause that inflammation of the pancreas. So if there's any history of pancreatitis in the past, we wouldn't use it because we don't want to risk that happening again. And then there is also a warning for a specific type of thyroid cancer. It's very rare, but if you have a personal history or a family history of this specific type of thyroid cancer, it would also be not an appropriate medication to use.
This is the podcast that allows you to eat whatever you want and then take a diabetes drug to lose weight. And occasionally we flip the health and wellness industries upside down so you can be your healthiest inside and out. I'm your host, Dr. Neal Smoller, holistic pharmacist, supplement strategist. Today's episode is Wizard of Ozempic. I'm so excited. We've done it, folks. We finally found it. The secret to American happiness, a weight loss medicine that actually works. It's sweeping the nation, taking pounds off people despite their bad habits, and taking medicine out of the hands of diabetics. I'm pumped, man. I'm trying to figure out how I can get an illegal prescription for it. I've got lots of shady friends, but nobody's giving me the medication hookup. It stinks. I've got it. It's just feet away from me in my pharmacy, and yet I can't. It's still eluding me. So I'm going to try to figure this out for my own personal and selfish reasons. So I'm going to make a couple phone calls today. First, I'm going to contact Dr. Ali Watson, Alexandra, as she's officially known, as a doctorate of pharmacy, completed her residency at the Albany Stratton VA, and she's currently a professor at Albany College of Pharmacy and Health Sciences. She serves as a clinical pharmacist with Community Care Physicians, where she's currently a part of their endocrinology weight management clinic. I'm hoping that she can help sort out the science for me, and then I'm going to reach out to a compounding pharmacist, Dr. Benjamin Jolley. He makes medicines from scratch, and he's the owner of Jolley's Compounding Pharmacy in Salt Lake City, Utah. And I'm going to see if Ben can get me that Ozempic cheaper than $900 a month. Very selfish today. So I'm going to have a conversation about Ozempic from the perspective of a very excited consumer that doesn't really have a lot of good information, and we'll see where it goes. And then I'll kind of give my thoughts at the end. Visit wellnessupsidedown.com for all things podcast related. Please subscribe to this show on your favorite podcast app and even over on YouTube, and give us a 5-star review as often as you can, each and every episode, because it helps us get seen and heard, and I think that we're worth it. If you're tuning in for the first time, know that I'm a fan of supplements done right, but I'm not a fan of the deceptive practices of the health and wellness industries. If I'm ranting, I'm not beating up on you because you tried something. I'm raging against the machine of misinformation and hype that got someone like you down the wrong path. Today, I might get a little ranty about my fellow brethren, my practitioners out here in the world that are doing shady stuff. So let's dig into it. Today's show is The Wizard of Ozempic. I'm going to speak with Ali about the science of Ozempic, and I'm going to speak with Ben about the business, if you can call it that, of Ozempic, and then we're going to give my 2 cents at the end here. So let's just jump in with Dr. Alexandra Watson, PharmD. So here's the thing. I'm going to do this no matter what you say, but I do want to give the air of, doing my actual own research. So I guess I'm going to talk to you. I'm at my doctor's office now. I know you're the pharmacist here and you talk about weight loss stuff, but I want Ozempic. So can we talk about this? I've read about it on TikTok. I've watched it on YouTube videos. That's how I do my research. And, that's where I get all my medical information. So can you, I guess, explain it to me? And I will be listening reluctantly.
Of course. Yes. So, Ozempic is a medication that has been out for several years, that's approved for type 2 diabetes.
Okay. I don't have that.
So it works really well with the body to help regulate how we digest food and regulate blood sugar so that we don't see these big blood sugar spikes after people have meals.
Hmm.
So the FDA studied it specifically for type 2 diabetes in order to get that control so that with people that have diabetes don't have organ issues in the future and kind of to really regulate that blood sugar. A lot of times people see it in the news because what happens when people start on Ozempic is they do have some weight loss associated with it.
Oh, that's what I'm
Um,
after.
weight loss is a great it's advantageous for people with diabetes and people without diabetes. But Ozempic specifically is really only indicated for those that have a diagnosis of diabetes, which really comes from lab values. So if your blood sugar has been high in the past, or if you've gotten a lab called an A1C that showed that your average blood sugar readings have been elevated for the last 3 months.
Yeah, no, I mean, I don't have diabetes at all. I just like the idea of being able to stuff my face and then lose weight. And so everybody's talking about Ozempic. Um, so if I don't have diabetes, can I just get Ozempic? I mean, I'm hearing about people getting it all the time.
So because of the benefit that was seen with Ozempic, the manufacturer actually remarketed or reformulated the medication into a different medication, which is called Wegovy.
Ooh.
It's the same active ingredient, which is semaglutide,
Hmm.
and they took the benefits of what we were seeing in the patients with type 2 diabetes, where it was regulating the way people were eating, reducing cravings, reducing appetite stimulation, having the food sit longer in the stomach, and it was reformulated into this medication, which is brand name Wegovy. It is FDA approved for weight management, but you do have to have specific weight cutoffs. So that's specifically based on BMI. So if you have a BMI over 27 with comorbidities such as diabetes, high blood pressure, high cholesterol, or a BMI over 30, which is considered obesity, those would be people that could potentially be considered for Wegovy. But there's a lot of other things you want to consider first. The medication's really only going to be beneficial if you've tried other lifestyle modifications in the past. So if you've tried diet and exercising, lower calorie reduction, low fat foods, those types of people that still can't lose weight after doing those type of lifestyle modifications might be a candidate for the medication. But you have to keep in mind that it's not a magic bullet, right? If you continue to eat a lot of high fat foods, a lot of foods while you're on this medication, you're not going to feel so great because that food is sitting in your stomach for longer. So it can cause some gastrointestinal types of side effects, things like nausea, vomiting, diarrhea, constipation. So it's definitely something that needs to be done in association with lifestyle modifications. It's not just going to be a medication that you can take to automatically lose weight.
I mean, I've tried everything from not changing my diet to not changing my exercise. I've even tried all of the different supplements over the counter, and I still haven't lost the weight. And I know you're looking at me going like, this guy could probably be an underwear model. And but I am actually. As a real piece, I have a BMI that's in the obese range. The only reason that people are like, what? My BMI is like 30.2. And the reason that people don't get that vibe from me is because the only thing I do all day is suck in my gut. That's the reason I have abs, is because of just holding in my stomach all day. But yeah, so yeah, I mean, I hear that you know what you're saying is that you have to do the lifestyle stuff too. And one of the big problems that I feel is that when you take this stuff, if you stop it, all the weight just comes back, and that kind of stinks. But I guess it's worth it to take it all the time. So I guess you're saying, so this Wegovy, is that like so I know Ozempic's an injectable, and I don't really want to stick myself, but I guess I will. I mean, I technically would take a suppository of this stuff twice a day if it made me lose weight. So is Wegovy injectable?
Yes, it's this similar type of injectable, a once weekly injectable. It is a different type of pen, so it's an auto injector.
Yeah.
So it does make the injection more simple. The pen does a lot of the work. You really don't even see the needle at all, but it is a once weekly subcutaneous, so that just means right under the skin, pretty small needle. Can take it without food, choose the day of the week that you would want to do it. So very similar to the Ozempic type of injection.
So it kind of sounds like to me that you're really hesitant to give Ozempic to somebody like me, or Wegovy to somebody like me. But all I'm hearing about are people just getting this stuff left and right and having all these great results. So what's up with that?
I think that's always been the search is people looking for this magic medication to lose the weight. And this is one of the first medications that we're seeing better safety profiles. We're seeing some better effectiveness for weight management. The previous medications that we had were stimulant types of medications that would increase your metabolism and have your heart race and have risks of high blood pressure. So now that we're seeing these medications that really work in a smarter way with the hormones in the body to regulate how we respond to food um, and how the kind of cells work to digest food, it is a smarter way to do it. So I think because it is safer, we're seeing 10% body weight loss
Oh,
on
all
these
right.
medications. It gets picked up in the media.
Yeah.
But I think the part that does often get missed is who's the best patient for it to be used in, what are the side effects associated with it, and then who shouldn't it be used in? Who should we definitely avoid these classes of medications? And because there's always going to be contraindications or specific people or past medical history that they it's just not an appropriate therapy.
Well, I mean, who would fit into that category?
So anybody that has already slowed down digestion, so gastroparesis is the medical term, but any person that has trouble digesting food, it's going to make it worse. So we wouldn't want to use it in those patient populations. There is also a warning of pancreatitis. So with all of these medications, there is a warning that it can cause that inflammation of the pancreas. So if there's any history of pancreatitis in the past, we wouldn't use it because we don't want to risk that happening again. And then there is also a warning for a specific type of thyroid cancer. It's very rare, but if you have a personal history or a family history of this specific type of thyroid cancer, it would also be not an appropriate medication to use.
Got it. So I heard a lot of big words there, but I also heard 10% weight loss. So, I'm not going to take the COVID vaccine because there was 7 people that had a problem out of the billions of shots that were given. But, pancreatitis I'm okay with. In fact, I listened to this podcast, Wellness Upside Down, and he talks about how turmeric has a 5% hepatotoxicity risk. But you know what? I heard it's good for inflammation, so I'm going to take that instead. I'm really good at math is really what this comes down to. So, all right. So you're saying all this great stuff. But again, I'm hearing that people are getting it left and right. So why is it that your office is giving me such a hard time in getting this thing when I can just, how are people just getting this drug without even talking to somebody?
Yeah, so unfortunately, what happened last year is that there was a major back order on Wegovy, the weight management medication. So what had happened was because it's the same generic drug product, semaglutide as Ozempic, it was being substituted. When the drug manufacturers come out with a medication, they kind of guesstimate how much drug to create based on the number of patients that have the disease state. Since Ozempic was indicated for diabetes, they only formulated enough for patients that have diabetes. So unfortunately, what happened was that it got out in news. I know it was on TikTok. A lot of celebrities were using this for weight loss medication. So people started asking for it. And because there's data with semaglutide for weight loss, practitioners began prescribing it off label for that use. And unfortunately, what happened was that the supply ran out because they weren't making enough for people to be using it off label for weight loss. They couldn't keep up with the demand. So patients that were using it for diabetes to control these chronic diseases, to keep their sugar within a low range so that they didn't have to have hospitalizations or worsening of the disease state, couldn't find their medication. So that was a huge concern. Even more scary is other places are popping up that are advertising semaglutide. The manufacturer has come out and said that they have not justified using the generic off-label for weight loss anywhere. So the question is, where are people getting this generic semaglutide from, whether it's these med spas or other places that are advertising it for weight loss? So that's something that you definitely need to think about. You don't know what they're injecting into you. It doesn't have any approval for being used that way. So unless it's the medication that has been prescribed by the provider that you're getting from a validated pharmacy that's been FDA approved, it's something that needs to be used definitely with caution or likely not at all.
But don't you think that like all that stuff is just about making money, like these high cost drugs and the pharmaceutical companies? Don't you think that's a profit driven thing? And like the people that are doing it cheaper, aren't those folks better?
It's tough because these medications are really expensive. The United States is one of the countries that has the highest cost of medications, and a lot of times it's justified of they're the ones that did the research and development that they need to have this cost of the medications in order to support manufacturing these medications. So it does often get passed on to the consumer. The problem with these less costly kind of side ways to get the medication is you have no idea what you're getting. There's been studies out there that have shown that some of these non-approved indications have stimulants, have steroids, have other things in them that could potentially do a lot of harm. So for that reason, it's definitely not worth saving some money or saving that provider visit to kind of go that route.
Yeah, I don't know. It's cheaper and I can lose weight, so I don't know.
So semaglutide has been offered in certain med spas, but that's a direct to consumer type of advertisement where the person is really choosing that this is going to be the therapy for them. Whereas this medication was indicated to be a discussion with a practitioner, a healthcare provider. So what really is recommended is if there is interest in a medication like this to go to a healthcare provider to have the discussion. They'll do a full workup. They'll look to see if it really is a hormone imbalance that is likely causing weight issues, or discuss these lifestyle modifications, things that you could potentially try before going to the medication. Because if you get started on a medication like this, it could potentially be chronic therapy. For now, we don't know how long a patient needs to be on one of these medications to really have that sustainable weight loss. So we'd rather do it in a more natural way. Can we meet with a nutrition, a dietitian, somebody that even cognitive behavioral therapy to learn why the weight isn't coming off? Kind of having that teaching aspect of what should I be eating? What is the healthiest foods for that overall well-being that would also lose to weight loss? Also talking about how quickly we should lose weight. It's not healthy to lose a lot of weight very quickly. So kind of having somebody that is there to follow up with you to help with that weight loss journey. If it does come to that a medication is appropriate for you, that should be down the line after these discussions, making sure that you don't have any of those conditions that would make the medication dangerous for you. If a practitioner is jumping to the medication first without having these discussions, that might be a concern. It's definitely something that you want to do the due diligence of kind of making sure that it is the best therapy for you. If you do go to one of these med spas and decide that you're going to inject yourself with who knows what is actually in these products, it could be doing yourself a disservice. You don't know what you're getting. You may have had one of those concerns of risk for pancreatitis, that inflammation of the pancreas, that you could end up in a worse place by kind of jumping ahead and not going through the healthcare process of looking to see if this is an appropriate medication.
I appreciate
Sounds good?
you coming on. It was good information, and I appreciate
Yeah.
you being okay with my sarcastic nonsense. So
Yeah, no problem. Yeah, thank you.
take it easy. All right. So, Ben, I heard about this Ozempic thing. I talked to a pharmacist. They didn't think it was right for me, so I'm probably going to do it.
Okay, awesome.
I looked up a local doctor. They do it. I don't know. They might be a doctor. They might not be a doctor. I know pharmacists sometimes call themselves doctor, so it might not be a real doctor. I don't know. But I asked if there's any way that I could get priority over diabetic people who need this medicine. And I also said that I wanted it cheaper. And she said, I've got the answer for you. We use a compounding pharmacy. And it solves all those problems. So I looked up a compounding pharmacy. I couldn't find anybody in New York. I called Utah, and I got you on the phone. So you're a compounding pharmacy, right?
Yeah. Jolley's compounding pharmacy is a compounding pharmacy. We don't do Ozempic though, or
Why
at least
not?
not compounded versions of it. Well, a bunch of reasons. Um, one, I don't know where to get the chemical that's in Ozempic. I've heard of folks getting a similar chemical, but not actually so-called semaglutide. I've heard of folks getting semaglutide sodium, which the FDA treats as a different drug. So that's one reason we don't do it. The second is we don't like doing, or rather, we don't do any sterile products, um, which, most of the time Ozempic is an injected drug, um, injected straight into the belly, under the skin, into the fat there. Um, At least Ozempic per se is.
I mean, I have plenty of that. That's why I'm looking for Ozempic. I want less fat to be able to inject into.
Right, exactly. Yes. Yeah, right, right. But yeah, we don't do any sterile compounding because the regulations are much more intense. The FDA often gets up in your biz, and that's not what we do. We do compounding for stuff that stays. If you can imagine a way to get a drug into someone where it doesn't go in their eye or in a needle into them, we can probably do that. But if it's going to require a needle or it's going to require a going in your eye, we can't do that. That requires a sterile pharmacy. We'll happily give you stuff that can go on your skin that doesn't need to be sterile.
Let me unpack some of this because some of that information I haven't heard before because this is my first phone call. But you were saying that you can't get the drug itself. Like you can't get the. So I don't know, understand how it works. So there's a drug that's made by a pharmaceutical company. And so what do? Do they just take that and then they turn it into something else? Like I don't understand how that whole thing works. You said you can't get it. And also there's a baby crying.
Right, yeah, this is my baby. In the background here, she's
You bring your baby to work? Is that what like you're at the compounding pharmacy? I know that right now. And the baby works for you? Is that what happened? Is it?
yes, yes, she does. She actually prepares all of the medicines, as it turns out. It's
Wow.
actually prepared by my 8-month-old daughter. So yes, that is how this actually works in real life.
Jolley's compounding pharmacy, prepared by an 8-year-old daughter. 8
8-month-old.
month old. Oh my God, 8 months.
Yeah.
Wow, she's got great hand-eye coordination for such a
Yes,
young
indeed.
baby.
Oh yeah.
I went to the drugstore. They said it was $900 to get this stupid thing,
Right.
and it's an injectable. And listen, if this thing works, I'll inject it into my eye twice a day. I just want to keep eating like crap, right?
Hmm.
And so, but you're telling me that you can't even get it, but then the doctor's telling me that the compounding pharmacies make it. So I just don't understand that.
Sure. Sure. So compounding, as a general rule, is a concept where a pharmacy will obtain a bulk powder. So instead of like getting a finished product, like Ozempic is a finished product where they put the active ingredient into solution with some stabilizing agents, put it into a pen, we give you that pen. That's the $900 a month product. I can get that one because it's made by a pharma company that I can just buy finished.
Yep.
When I'm preparing a compound, like say progesterone capsules is a very common one that we do.
Yep.
We buy straight up progesterone from a chemical company, not a pharmaceutical company. So we have pure progesterone powder that then we mix with various ingredients, put it into a capsule,
Yep.
and that becomes the finished product. A compounding pharmacy that is preparing some kind of duplicate of Ozempic um, is probably sourcing semaglutide powder. Semaglutide is the active ingredient in Ozempic and in a product called Wegovy that's actually used for weight loss
Hmm.
only. Um, and so a so some pharmacies have found some source for Ozempic. Ozempic, by which I mean semaglutide, not actually Ozempic. Any pharmacy can buy Ozempic as long as it's not in shortage, which it has been on and off for the last year because of this weight loss thing.
Yeah.
Compounding pharmacy has to obtain bulk powder and then put that into some sort of dosage form that the patient can use, whether that be a duplicate of Ozempic, which is, injected generally into the belly, um, or some kind of other dosage form. I've heard of folks using it, using like a lozenge that goes under the tongue, some folks doing a nasal spray. I'm not entirely certain whether those work or not. The active ingredient in Ozempic is used in a tablet, also made by the same company.
Okay.
That tablet's called Ribelsis.
Okay.
It has the active ingredient semaglutide together with a, filler called an absorption enhancing agent that basically cuts a very tiny hole into your stomach so that the drug gets through.
Is that why you
Um,
don't eat as much because you have a bleeding hole in your stomach?
Basically, I don't know. No,
Yeah.
it's
So it's
probably
an
really just the
absorption
drug itself.
enhancer that just makes the thing go into this. So wow, that's interesting. So you're saying that in order to do this at a compounding pharmacy, you first have to get your hands on the bulk raw material. And you're
Hmm.
saying that that's not really readily available from chemical companies, but there are some places that are somehow getting it from somewhere.
That's my understanding. So we use like 3 to 5 depending on the availability of products, but usually three chemical suppliers.
Right. And like those are regulated, right? So they have rules that
Yes,
they have to follow, right? And so if they could get it, they probably would get it, right? Because it's crazy times.
absolutely, because they want to make money, right? And they make money by selling me chemicals.
And
And so if
hot
they
chemical
could
like
source
this, I would say,
semaglutide, they
yeah,
totally would send it to me.
yeah.
But none of the ones that I usually source from have this product.
Okay.
And so when I've talked to other folks about this, my understanding has been that other pharmacies are using the so-called salt form of semaglutide,
Okay.
which the FDA regulates salts as different drugs,
Right.
which is weird because it feels like it's the same drug. It's 99% the same drug by like weight, but it's semaglutide base is what's in Ozempic, and what I've understood people are generally using is semaglutide sodium.
So they can get their hands on that thing, but not the actual thing
Right,
that's in Ozempic. That's
right.
interesting. So should I be worried about that? I mean, should
I
I
don't
care?
know.
I mean, I listened to the Wellness Upside Down podcast, and this guy's a crazy person. And he talks all the time about very simple things like magnesium and how if you use magnesium citrate, you'll only get 5% absorption. And then if you use magnesium chelate, you'll get 90 or 55% absorption. So it's like a big difference. And it seems like the salt form would matter, is what that dork says. But I'm confused. Like, that's interesting. So, and it's okay, it's legal for those pharmacies to use that? And promote it for what it is?
Is it legal? I don't think so. The
Okay.
Food, Drug, and Cosmetic Act, Section 503A, if you want to be a nerd and go read the
Wow.
law, is what allows for compounding to exist at pharmacies in federal law. And it says that pharmacies who want to compound something have to either use products that are listed in a list of formulations called the United States Pharmacopoeia or the National Formulary. And I've got friends here now. I've got another my
I used
5-year-old,
just
6-year-old
as an
here.
aside, I have my kids on the podcast occasionally too, but
So it either has to be listed in the USP or the National Formulary, or it has to be a component of an FDA approved drug product. If it's not one of those things, it's no longer considered a compound under federal law. It's technically a manufacturing an unapproved drug product.
oh.
And it's now an investigational new drug that would require the FDA to give you an so-called IND approval to basically study this drug.
Yeah.
But you can't just give that to members of the general public. You would have to give them all sorts of, uh, basically you're doing a clinical trial at that point. And that comes with all of the IRB stuff and making sure that you're doing research ethically. Like you can do that. That's fine, but you have to go through the right channel of obtaining
But like the compounding
obtaining those
pharmacies
approvals.
that are doing this aren't doing any of
I
it.
don't think so. I haven't heard of anybody actually going and getting an IND from the FDA, and
All right. So
I can't imagine anyone actually doing that.
my doctor says go to a compounding pharmacy to get that's what we do. We use these guys and they make the Ozempic for me and it's going to be cheaper. But you're telling me that compounding pharmacies aren't even using the thing that's in Ozempic and it's probably not really legal to do that?
I don't think so. And what I've observed as well from like just patients bringing in like this stuff has been all over the place for the last I don't know year now.
Yeah.
And so I've actually had a couple people like bring in these Ozempic duplicates and show them to me. And like there was one pharmacy that was making this stuff, selling it to a clinic, and then the clinic was giving it to the patients. That is also not allowed under federal law.
Oh, so like they were instead of like selling it to the patient, they were selling it to the doctor.
Yes.
Oh, that's
The,
not, you're not allowed to do that, are you?
no, so you used to be able to do that, and we would actually do that all the time for dentist offices. We'd give them an antibiotic paste or a numbing agent for them to use when they were seeing a patient who had particularly bad tooth decay, right? Um, but in 2012, and sometime before that, an idiot pharmacy in Massachusetts called New England Compounding Center
Mm-hmm.
um, was selling drugs like this to offices, compounded products, selling them to offices across the country, and started doing shady stuff like not sterilizing their equipment before using it, letting mold visibly grow in their lab, sending prescriptions out for Donald Duck and Mickey Mouse. Um, and they got busted, and it caused a national uproar because, as it turns out, not only were they doing sketchy stuff, that sketchy stuff had consequences. They killed like 70 people.
Oh my God. So wait, a compounding pharmacy killed 70 people?
Yeah,
But I mean,
yeah.
it's
So
only
they,
70 people. COVID kills like 1,000 people a day, so it's not a lot
right,
of
right. It's
people.
not a ton of people, right? But like it's 70 more people than we would like. Um and it gave the FDA nightmares of why the FDA started being a thing in the first place. Um like over 100 years ago, there was the FDA exists because like 100 years ago, a pharmaceutical company produced a drug called sulfanilamide elixir. And elixir means it's in alcohol. They weren't putting it in alcohol, they were putting it in antifreeze and selling this to pharmacists to give to children. And as it turns out, drinking antifreeze is not great for your health and caused about 70 kids' kidneys to shut down, and therefore some died. So the FDA was like, oh my gosh, this is the same thing over again. They went to Congress. Congress passed all these changes to the law that made it so that pharmacies can't prepare medicines to sell to physician offices unless they get a special licensure with the FDA called um, basically certification under Section 503B of the Food and Drug and Cosmetic Act.
Mm-hmm.
Um, very, very few pharmacies do this, and the ones that do, I basically only hear stories of them going bankrupt, because the regulatory regime for them is probably too intense. But at the very least, the FDA has a pathway for pharmacies to do this. It's just that no one wants to do it, and the ones that do are like divisions of giant, huge companies like AmerisourceBergen
Yeah.
that then go out of business like 5 years later because the FDA inspects them and they didn't have sterile facilities or something.
Well, so what you're
Um,
what you're explaining to me sounds a lot different than what this doctor's telling me. The doctor's telling me that like it's super easy to get. I can just go to call they actually have it there, and they're saying everything's fine and it's Ozempic. And so I don't understand like, so you're saying that there was a pharmacy that was sending stuff to legitimate doctors, right? And they were using this pharmacy. The pharmacy wasn't doing what they're supposed to do, and the doctors didn't check, and then people died and got hurt.
yeah, yeah. Specifically, they were trying to prepare a sterile product. Remember, we don't do sterile products at Jolly's on purpose. This is part of why. They were preparing what was supposed to be a sterile product without any preservatives in it that would prevent any bacteria or mold or anything from growing in it. They had mold growing in their lab. That mold was getting into their product, which is methylprednisolone, a steroid. And then they anyway, that product was contaminated with mold. They were injecting this into people's spines for pain,
Oh,
and now these folks have mold growing in their spines. Not a great situation.
but so that stopped though, right? So that happened, and then everything got fixed, right? So like I don't have to worry about that with Ozempic, right? Or should I be worrying about that? I mean, I don't know.
Well, if you're injecting this stuff, maybe you should be, especially if your doctor's office somehow has the medicine.
Yeah.
A facility that's registered with the FDA under this 503B to be able to actually ship to doctors' offices, they're not going to be touching Ozempic. I guarantee
Oh.
it. Because again, they have to follow the same guidance that it has to be a component of an FDA approved drug product. Semaglutide sodium that most of these compounding pharmacies are using is not a component of an FDA approved drug product. And like this weirdo at the Upside Down Health podcast says, salts actually make a difference in absorption, right? I don't know whether it makes a difference, but I sure know it hasn't been studied whether it makes a difference. Um, and so you're basically using yourself as a lab rat.
So these sound like red flags to me. Not that it's going to change my mind. I'm still going to do it because I want to lose the weight. But like,
Right.
these sound like red flags. So the fact that it's compounded at all is a big red flag because you can't really get the ingredient, and then it's got to be turned into an injection, which then you have to make sure that they're doing everything right. And it sounds like, this could be that same thing all over again, right? That thing that happened in New England that caused all this death and pain and the change of your industry, as you're saying, that could happen again. And, the thing is, like, why doesn't my doctor know? Like, I don't understand why my doctor says this is okay. Is my doctor checking and then they know better? Like, did they already look into it?
That's a good question. I don't know. I generally have to assume the best about physicians that prescribe compounds. They generally have at least had some sense of what compounding is, but most physicians haven't read the Food, Drug, and Cosmetic Act. I can't say I've read the entire thing myself, and this is like stuff that I have to know to practice is what it says in the law, because if I want to do something, I have to make sure that it's legal. Um, but physicians that are prescribing this stuff, they don't necessarily have to. I mean, you would expect them to know what the Food, Drug, and Cosmetic Act says, but like, I don't know. Have you read through
No,
the entirety of the Medical Practice Act in New York? Because I sure haven't read it in Utah.
no.
Um, so like, I don't expect people outside of compounding specifically, like compounding pharmacists specifically, to know what the law says. Um, even physicians. Now, if someone's doing this like as like this is their thing, they are prescribing semaglutide for patients to lose weight, I would expect that they would look into this and ask a skeptical person, is this legitimate before they start going? But,
There's
here
money
in the
to be
United
made.
well, what I was going to say is here in the United States, we seem to think that Apollo's staff is the symbol of medicine, which it's actually the symbol of commerce and making money. So I think that that's appropriate for U.S. healthcare, that actually is the symbol of U.S. healthcare.
Let me break this down a little bit more, right? So we're worried about the compounding because it's not really the thing, and we're worried about the injection. Well, why don't I just not get it injected? Like you're saying that there's places that are doing lozenges and sprays, right? And so like, why don't I just do that then?
The reason that that I would be concerned about taking a nasal spray or lozenge personally is um, semaglutide's a pretty big drug. Um, it's a
Big,
peptide.
big, like popular.
No, I mean like large molecularly. And so it needs like when you give semaglutide by mouth in a tablet by itself, they did this in the study. I remember when I was in pharmacy school, Ribelsis was being studied, the tablet form of Ozempic. And so I actually had to do a journal club on this, and I read through it, and they did a study where they compared just without this absorption enhancer and with this absorption enhancer, and it was like the person absorbed like 1% of the dose when you gave it without the absorption enhancer, and like 70% of the dose with it. And so, um, anyway, this drug is not one that you can just absorb via a tablet without adding additional ingredients to make sure that it crosses through your stomach, which is trippy. Um, that whole concept of giving someone an absorption enhancer is kind of wild to me.
Yeah, no, I'm familiar.
But then, like giving it under the tongue or giving it as a nasal spray, maybe it goes across the the tongue into your blood. Maybe it goes across the nasal mucosa into your blood and then has an effect on your brain and on your body in general. But I don't actually know. And so it hasn't really been studied. So we don't know if it absorbs. Um, if you were to take it and you were to say get nausea, which is a very typical side effect of Ozempic, it's probably doing something, and you're probably getting at least some of it absorbed. But again, I don't know. I don't know if you're getting the right dose. I don't know how you would find the right dose um, under the tongue or nasally. Um, you're probably still not. It's probably still illegal under the like. Is it a FDA approved drug product component or not? It's not. Probably. Um, which isn't your problem. That's the pharmacy's problem,
Yeah.
right? So I don't know if it absorbs. So you might be buying snake oil that really doesn't do anything for you. It might work. It it might be overdosed. It might be underdosed. I don't know.
Right. Well, I
Um,
mean,
those are my main concerns on it.
here's my assumption, right? So the drug company, which is like this multi-billion-dollar company that has all the scientists and does all the research and want to make the most money possible. They know that if they do an injection, they're going to have less and less people to do it. And if they can cut corners and do stuff cheaper, they would do it. So clearly, when they're adding the absorption enhancers or using the injection, they're doing that for profit, and the compounding pharmacies are smarter and they're just doing it more efficiently. That's my assumption, is that the drug company who knows everything and did all the research clearly doesn't know what they are doing. And the compounding pharmacies know that if you just put it into a lozenge and maybe add B12, then that's all you really need to do. That's my assumption as a consumer.
Right, right. I mean, obviously, a pharmacy who has basically zero budget for actually, doing a clinical trial that costs millions of dollars obviously knows better than the scientists who were like, okay, how in the world do we get this drug to market so that we can sell it for $900 a pop?
Yeah.
Who spent millions and millions of dollars um, figuring out, okay, now how do we get this into people? How do we convince the FDA that this stuff actually works? Blah, 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 blah.
And how to get it
Obviously,
to
they
the
have
biggest
no idea.
audience, possible. They want
Right.
everybody to use it so that way they make billions and billions of dollars. But
They end up on an injection.
yeah,
So obviously they're idiots.
yeah,
And they should have just put it in a nasal spray
yeah,
because that worked out great for Pfizer with ketamine, putting it in a nasal spray. Obviously, this will also work for Ozempic, that is the same drug, right?
yeah. I mean, so it sounds like there's a lot of reasons why I shouldn't be doing this. It sounds like there's the if I'm going to do this, I should be taking, like, not to sound like I'm a shill for a pharmaceutical company, but it sounds like I should just be using the finished product because there's questionable legality. There's problems with the dosing, there's problems with the form of the thing. There's problems with the potential danger of taking a compounded product, especially sterile ones. It might not even work, and it doesn't sound like the doctors are asking the right questions. The pharmacists that are making it are just kind of making it without asking the right questions. So it sounds like a huge cash grab. If I were like an outside observer, it sounds like just because it's super popular and we can make money on it, everybody's rushing to do it. Is that like a fair read?
I, I think so. Yeah. Yeah, that's what it sounds like to me.
Because like I feel like I hate the FDA. I hate drug companies, and I feel like all they want to do is make money. And I a little bit like these guys are like Robin Hood. They're robbing from the rich, giving it to the poor, and then taking a problem and solving it. The problem is that this is a $900 drug that works and can help people, and they're overpricing it. So I feel like, despite all the stuff you're saying, it's still doing a service at the end of the day. Um, is that do you like? Don't you agree with that?
I mean, to some degree, yeah. Like the thing that mostly bugs me about this is like I can't. I feel like if I go outside the bounds of what the law says of what compounding is, I'll get busted. And I think that the pharmacies that are doing this are just hoping that they don't get caught. Um, and and it's not just it- like we haven't even gotten into the fact that they're probably violating um Novo Nordisk's patent on this product, right? Um, there's like Novo Nordisk did a bunch of research into this drug and got patents on it. Whether you like patents or not, whether you think that drug companies should be able to price products at wherever they want while they're under patent. They are under patent. And so they do have the protection under our law that they're the only ones who can make Ozempic. Um, when when the same thing happened with like Viagra, folks wanted to get compounded Viagra for a long time because it was cheaper. Um, most of the suppliers of the chemicals wouldn't provide sildenafil powder and wouldn't provide for Cialis, wouldn't provide tadalafil powder because it was under patent. Um, and compounding a product that is essentially duplicating something is specifically prohibited in the law. You can't make a you cannot produce a product that's like, okay, I'm just going to look at the ingredients list for Ozempic, put that into a test tube and in a syringe and send it out to a patient. That is specifically prohibited. If there's a FDA approved drug product and you go try and make it essentially a duplicate of it, you are definitely in violation of the Food, Drug, and Cosmetic Act, and almost certainly also violating the patent of the drug company. Which, like, yeah, there's some element of Robin Hood type of stuff going on here, but like, I don't know. It just doesn't feel like a level playing field to me. Like for me, it's really important that yes, we encourage small businesses um and like we prevent giant companies from getting monopolies on things unless like there's a good reason to, like we give them a patent on the drug because they brought a drug to market that didn't otherwise exist. That's worth giving someone a monopoly on for a short time. That's why our patent laws exist, because we like to have new drugs, right, that do new cool things like you know treat diabetes really well and cause people to lose lots of weight that they otherwise wouldn't. um that's a social good that's worth promoting. But it, people need to follow the law and um, need to all be playing by the same rule book. Otherwise, we end up in a situation where folks who are willing to break the law make money, and people who aren't willing to break the law don't make money and get driven out of business and then get bought by the people who break the law. Right. That to me is one of the problems with this whole thing is that like it's the concept of bad money drives out good. And folks that are willing to break the law and bend the rules will drive out people who are not willing to break the law because they know what it says.
It's almost like there's two problems where the drugs are overpriced and there's compounding pharmacies violating their law, right? And so there's something two wrongs don't make a right. I'm not too sure
Yeah.
what that was. Something,
Yeah.
but thank you for your time. Again, like it's given me pause. Clearly, there's a chance that my doctor isn't even aware of any of these problems and is checking because I'm sure they're just assuming that whoever they're dealing with is following the rules. Nobody's asking any questions. The pharmacies are just providing this stuff and could potentially repeat that horrible thing that happened that you're telling me about from New England because of, corner cutting and just the gold rush kind of mentality. But you know what? I'm still going to do it.
I mean, be my guest. Like I've given you fair warning. I think I've given you some ideas of how to make sure that you're not gonna get um you're not gonna get some product that'll kill you. At the end of the day, that's your choice, and that's between you, your doctor, and the pharmacist that eventually you find that does do this. It's not gonna be me, but like I guess I would encourage you to like maybe interview the pharmacist who's making the stuff and ask them these questions and see if you feel comfortable getting the product from them. If you do, great. Go ahead.
I don't know. Based on what you said, it doesn't sound like there's any way that this works. It sounds like it's illegal all across the board.
Probably, but like, yeah, I don't know. It's no one's taken anyone to court yet, so I can't prove that it's actually illegal.
Right.
Everything's legal until it actually ends up in court and gets proved to be against the law, even if it's very obviously against the law.
Right. All right, Ben. Thanks, man.
Have a good one.
So I want to thank both Ben and Allie for helping me on such short notice. My buddy Ben in particular, who's an exceptionally busy dude and young father, clearly. It was so awesome. He helped me out in a pinch. You know, he's like, I can meet with you at this time. And like, that was the only time that worked for me. But he's, you know, got cute kids, thank God. They look like their mother. Okay. So taking off my I'm excited about Ozempic hat for just a moment, I want to have a frank discussion. I called this episode The Wizard of Ozempic because we need to peek behind the curtain. Do I think that this class of drugs has a great potential to help people maintain a healthier weight? I absolutely do. And I think that this path deserves further exploration and caution, but hopeful optimism. It's definitely in order this time, right? As somebody who's jokingly offered cocaine to people as a natural way to lose weight, that's the best that we had, stimulants. And now we have something a little bit more. But now we have this potential, and it's created a hype machine. And the hype machine is for a product that's going to have a nearly infinite demand in our culture because we all want to have this magic thing. I've joked about this with so many friends, and they're like, yes, get me that thing, right? You don't have to sell this stuff. It's like the boar's head baloney of the medical world. It practically sells itself. But, you know, the fusion of these three things, the potential, the hype, and the frictionless sales process means that one thing is for certain, that the vultures are circling. There is profit to be made, and guess what? That profit to be made will come at your expense. The doctors are flinging this stuff like Oprah giving away cars. Pharmacists have no problem living on the darker side of a gray area, if you can even call it gray area. I don't believe it is. We're jumping on every opportunity to make a buck, right? And I get it, probably more than anyone. Healthcare in this country is broken. It's a for-profit system that was built on the independent practitioner that it seems to no longer value, right? I'm a fourth-generation provider in my community. I know that what I do is not only great, but it's better than any other option that's brought by the chain pharmacies, right? And I want that to work, and I fight tooth and nail, probably way too hard, every single day to keep that vision alive. But here's something that you have to hear. I can't make any money owning a pharmacy. The first time where things were linear was during COVID. And I took full advantage of that. I gave tens of thousands of vaccines for patients, and it was the first time that the healthcare games weren't played. They were all pushed out of the side to incentivize practitioners to do the right thing. And so we did. We took advantage of it. It's a lot different than selling stuff that is kind of not legal, you know? It's a little bit different. So every time something like Ozempic compounding comes along, to survive, we all jump on this bandwagon, right? Hoping to cash in. I have to tell you, pharmacists right now are hosting classes to other pharmacists on how you too can get rich on Ozempic weight loss in your practice. Ben and I talked about all the shady practices that pharmacists are doing without any problem. And it won't be long until a compounding pharmacy A is paying not compounding pharmacy B or Dr. X to refer patients to them in illegal kickback schemes. Don't think that that stuff doesn't happen, right? It's happened before and it's going to happen again. And whatever justification you want to add to this, doctors and pharmacists, this is a cash grab, and most of us are knowingly doing it in a manner that's probably illegal and definitely detrimental to our story. Pharmacists were always known as the most trusted profession. The story of the accessible, community-minded healthcare practitioner filled with integrity, breaking down complex medical information into understandable terms and advising their patients on the best choices for their health. What to do, and more importantly, what not to do, sometimes at their own financial detriment. That story is destroyed when we jump from trend to make a buck. And we become the charlatans that we stood in opposition to before. And we do it because we kind of have to, or at least we think we do. So if I'll criticize the modern pharmacist entrepreneur for anything, it's about a lack of innovation. Instead of identifying a need and bringing our pharmacist brain to that game to change the paradigm, we change our brain to fit the paradigm. So we're not riding waves, even. We're engulfed by them. And we could be making the waves, or at least creating our own bigger waves. For example, instead of revolutionizing the wellness and supplement space by bringing the best of what we are, therapy and evidence experts, we copy and we become functional medicine doctors and alternative medicine providers. That story, those practitioners, that's an easy to sell thing. It's more recognizable to consumers. It's already working for them. And I want it to work for me, but it takes away from what you are. So have the confidence to innovate, man. Pharmacists are valuable. Stop hopping from cash grab opportunity to cash grab opportunity. Lean into our story. Speak out and speak up. So clearly I'm disgusted. I'm watching people try to profit off this by selling knockoff drugs with no due diligence. Speaking of stories, it's the same old story, isn't it? Right? Hype, that marketing propaganda, not meeting the hope, the science, and the potential. Doing the right thing takes a backseat to making money, just like supplements. It's more expensive to make a supplement that checks off all the boxes, the science, the compliance, the virtues, the values, the things that I talk about. It's easier to sell the hype that vitamin C will boost your immune system, even though that's total nonsense. It's simpler to put our collective heads in the sand as businesses, regulatory bodies, as individuals, as consumers, instead of making and asking the tough questions like, is this safe? Is this legal? Is anyone paying attention? So my beef is not with Ozempic at all. If you hear one thing, hear this. I think that there's potential here with all of these drugs in this class, right? I hope that more than anything, people can have access to a tool like this. I think it's important to have it here because the end goal is to fight the obesity epidemic that's plaguing our country. I'd like to start on the food supply and behavior issue, on that side of the argument. But if the battle begins on the other side, the end, the weight control side, that works too, man. I'm for it. So my beef, though, is with the profit first, patient last mentality in supplements, in wellness, in the healthcare system, in the individual people that are making these decisions on a transaction by transaction basis, like, it's going to be fine. And it might be fine this time. And it'll be fine until it's not. And we've seen it not be fine. And it really, really hurts lots of people. So we've got choices. You could say that I'm asking people to make tough choices, but I don't think that they are. I think that we've been sold fast and easy for so long that we've broken our brains, and the right thing feels like the hard thing. So patience. It's all about wellness practices, man. Climb that wellness pyramid. It's a structure for living a healthier life. It's a framework that cuts out all the BS. And if an honest, trusting medical professional feels that Ozempic or whatever iteration of Ozempic there ends up being, if they think that's a good choice for you, go for it. But do your diligence, right? Don't try to cut corners. And practitioners, let's get confident, man. Innovate. So weight loss is trending. Great. There's drugs involved. Great. You're an expert. Speak on it. Become a nutrition and wellness expert where this new trend is just another tool in your toolbox. But more importantly, earn the reputation in your community and in your region as being the expert because you're discerning. You question the validity of the trends and you educate folks on the importance of due diligence. Practice wellness with integrity. So that does it for this week's podcast episode. Thanks again to Ali and Ben for coming on. I really appreciate what they did here for me today. Take a few minutes, give us those 5-star reviews, and share the podcast to your social feeds. Visit wellnessupsidedown.com for all things podcast related. And remember, being our healthiest starts with being honest about ourselves and the health and wellness industries, and then blazing a new path, marching forward one step at a time. I'm Dr. Neal Smoller, and I've got your back. Thanks for joining. There are solid anecdotes, there's formal surveys, and even reasonably sized clinical trial data that shows that CBD is so good that it's an anxiety buster or sleep support agent that people can use instead of benzodiazepines or Ambien or things like that, which is pretty awesome.